Hello, good morning, guys. So today we are going to discuss cardiomyopathy. So this now involves the muscles or the cardiac muscles, which is in the myometrium. So cardiomyopathy, what is it all about? It's a heart muscle disease of unknown cause. So take note, it's the heart muscles that are involved here, and the cause is usually idiopathic. But there are classifications. Primary, that is where it is caused by an unknown cause, so it's idiopathic. Secondary, it has an underlying pathologic condition that has resulted to cardiomyopathy. So it can be caused by various um, predisposing factors such as drugs, viral infections, other pre-existing conditions such as hypertension. So those are secondary forms of cardiomyopathy. Now we go to the types. We have dilated or congestive cardiomyopathy. So it's characterized by significant dilation of the ventricles without significant hypertrophy. So meaning the ventricles of the heart are dilated, but there is no hypertrophy of the cardiac muscles. So the cardiac muscles did not enlarge somehow. As you can see here in the illustration. For the normal, it appears like this, but look at the ventricles in the illustration. The heart muscles, the cardiac muscles there, as you can see, they appear normal, but the ventricles are enlarged. They are dilated. And there are different types of dilated cardiomyopathy. We have ischemic cardiomyopathy. So ischemic meaning there's limited blood flow that has resulted to this. Idiopathic, so unknown cause. Hypertensive cardiomyopathy, so it's brought about by hypertension. Infectious, it is caused by various forms of infection, either viral or bacterial. Alcoholic cardiomyopathy. So for those who are alcoholics, this can be one of the complications of being an alcoholic, having cardiomyopathy. Or toxic cardiomyopathy brought about by drugs, most especially illicit or illegal drugs. So if you are taking too much of these illicit drugs, you can have toxic cardiomyopathy. Peripartum cardiomyopathy. So this usually happens for an unknown cause during pregnancy, and it usually occurs, take note, around the last month of pregnancy. I repeat, last month of pregnancy. And the last one, tachycardia-mediated cardiomyopathy. So tachycardia is usually happening, or there is an increased heart rate for patients who have tachycardia-mediated cardiomyopathy. Now, pathophysiology. Ventricular dilation has resulted from the degeneration of the myocardial fiber. So it has degenerated the cardiac muscles. Now, once this happens, there will be decreased ejection fraction. So a little amount of blood will be pumped out from the ventricles, leading now to the pooling of blood inside the ventricles. And if that happens, there is going to be a mural thrombi. So a thrombus formation will occur on the inner lining of the heart, which can be very dangerous because that can be an embolus later on, which can lead to heart attack. And of course, there's altered valve function. So valves will not work well with dilated ventricles. If these things happen, there will be a decreased stroke volume and a decreased cardiac output. So if there's a decrease of these two, we expect that the circulating blood in the arteries are less than what is expected. So there will be lesser oxygen and nutrients circulating in the body of this patient. And if this continuously happens, this later on will lead to heart failure. So what are the signs and symptoms? Since the patient has lesser oxygen and nutrients circulating in the body, the patient is going to feel fatigue or weakness. And usually this is followed by left-sided heart failure. You already know the signs and symptoms of the left-sided heart failure. And there will be narrowed pulse pressure as well. And if you auscultate, you can hear S3 to S4 gallops. Dub, 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 dub. So those sounds like that. You can hear heart murmurs as well. And there will be chest pain, since there's also limited blood flow to the myocardium or to the heart as well, because of the decreased stroke volume and cardiac output, it's not delivering enough oxygen to the heart. So how is this diagnosed? It's done through echocardiography, ECG, chest x-ray, and cardiac catheterization. Always remember our nursing responsibilities once doctors do these types of diagnostic procedures. So this is how dilated ventricular cardiomyopathy looks like. And there's a degeneration of the heart muscle. So treatment. Treatment, if there is a known causative factor, the doctors need to correct this. And also symptomatic treatment for the heart disease. If they have heart failure, for example, if they have dysrhythmias, the doctors need to control this with these drugs like digitalis, diuretics, anticoagulants, since there will be blood clots. There is thrombus formation, mural thrombi in the ventricles of the heart, vasodilators to control hypertension, and antiarrhythmics to control dysrhythmias. But if the patient's heart really is suffering a lot, there's really a change in the muscle tissue, heart transplant orthotopic is going to be done. When we say orthotopic, the whole heart is going to be removed, and a newer heart, a healthier heart is going to be transplanted into the patient. So once heart transplant has occurred, you should know your nursing responsibilities post-op heart transplant. You need to monitor for signs of rejection and check for pacemaker. One of the things that they are going to do is to apply pacemakers as well to help the heart pump blood. So there. In the application of the pacemaker here, this time, the latissimus dorsi is the one used. And that is where they are going to apply this pacemaker. So there you go. In order to help the heart pump blood. So they are going to use the latissimus dorsi muscle. So take note, once this is done, there will be limited movement of the left limb due to the involvement of the latissimus dorsi muscle. So it is somehow wrapped around the heart this time to help pump blood in the ventricles of the heart. Now we go to number 2, hypertrophic cardiomyopathy, or also known as hypertrophic subaortic stenosis. As you can see here in the illustration, it is characterized by the enlargement of the heart and heart muscle. And you can see here, the one that is really enlarged is the interventricular septum. So that structure that divides the right and the left ventricle. So it is enlarged. And types of this hypertrophic cardiomyopathy, we have obstructive and non-obstructive. Of course, when you say obstructive, it can obstruct blood flow, which is very, very dangerous because it will further limit the oxygen carrying capacity of the blood, or oxygen delivery rather, to the different organs of the body. And of course, we have the non-obstructive. There's still blood being pumped out, but only in a few amounts. So pathophysiology, we have the ventricular and septal hypertrophy, as you have seen from the illustration. If this happens, there will be decreased ventricular filling. So since the enlarged heart muscle, most especially the septum, is taking up space in the ventricles, the ventricles will only contain a small amount of blood. That's why there's decreased ventricular filling. And there is decreased effectiveness of contraction because for a thickened heart muscle, it's not effective in pumping out blood. And there's also narrowed coronary arterioles. So there are multiple small areas of ischemia and necrosis. This happens if there are narrowing of the coronary arterioles. It will only feed a small amount of blood to the myocardium. So there's impeded ventricular contraction, leading now, same as the previous pathophysiology, to decreased stroke volume and cardiac output. And if that happens, arrhythmia is going to occur and or heart failure. So again, the end result of this is heart failure. Signs and symptoms. The patient is going to experience dyspnea. And since there's narrowed coronary arterioles, angina is going to be felt by the patient. So the patient will feel chest pain. We have a different topic for this later on. That would be our next one regarding coronary artery diseases and angina. Syncope, fainting spells due to the lack of oxygen circulating in the body. Fatigue, of course, they will be feeling so much tired due to the lack of oxygen being circulated. Palpitations will be felt. And if they are going to do echocardiography, they will visualize that the doctor is going to see or visualize that there is mild cardiomegaly, so enlargement of the heart. Sudden death can occur, most especially if there's obstructive type of cardiomyopathy. And heart failure, signs and symptoms of heart failure. Same thing goes with the diagnostic procedure, echocardiogram, chest x-ray, ECG, angiography, cardiac catheterizations. Always remember our nursing responsibilities for each of these diagnostic procedures. Treatment. Now it's symptomatic treatment. The cause of this is unknown, so we are just going to treat the symptoms. We are going to administer drugs such as beta blockers to control hypertension, calcium channel blockers, again for hypertension, anticoagulants to prevent thrombus formation, vasodilators for hypertension, digitalis if the patient is experiencing heart failure, nitrates for angina, and other inotropic agents are contraindicated. So these drugs are contraindicated for patients, the ones in red: vasodilators, digitalis, nitrates, and other inotropic agents. And we need to, or the doctors are going to convert the atrial fibrillation. If atrial fibrillation occurs, the doctor is going to perform defibrillation. And for defibrillation, our nursing responsibility there is just to stay clear of the patient. So if the doctor says clear, we are not going to touch the patient, or else you are also going to receive that electrical shock from the defibrillator. So once the doctor says clear, you or we are not going to touch the patient. So that's how defibrillation is done. So in order to treat atrial fibrillation. Now, surgical procedures. Ventriculomyotomy or myectomy is going to be done. So what are they going to do there is to incise that thickened muscle or cardiac muscle in order to treat this disease, and or cardiomyoplasty. They're going to repair the thickened cardiac muscle. And there's another procedure here where they are going to do alcohol septal ablation. So in this procedure, it's similar to cardiac catheterization, wherein the doctor is going to use alcohol through the cardiac catheter. So they're going to introduce alcohol into the area where the heart muscle has thickened. And alcohol is used to, since alcohol is toxic to cells, alcohol will cause these cardiac cells or cardiac muscle cells to shrink and die, causing the heart muscle to decrease in size. So that's what alcohol septal ablation is done. So next is the restrictive cardiomyopathy. So it's characterized by an impairment of ventricular stretch caused by fibrosis and thickening and rigidity of the ventricular walls. Signs and symptoms here include the following: P and D. Paroxysmal nocturnal dyspnea can occur. So when we say paroxysmal nocturnal dyspnea, this is the dyspnea that occurs at night. So, or just the normal dyspnea can occur with this condition. Fatigue, heart failure again, mild or moderate cardiomegaly can be seen. S3 and S4 gallops again can be heard during auscultation, and there is going to be heart block. When you say heart block, of course, once this happens, since there's restrictive blood flow, it will block the pumping of blood into the aorta. And this can be very dangerous because it will no longer, or the blood, or the heart rather, can no longer pump oxygen-rich blood into the different organs of the body. Diagnosis, it can be done with the various diagnostic procedures that we've discussed, together with radionuclide imaging and echocardiography. Treatment is to restrict exercise, since they will easily tire with any strenuous activity that the patient is going to do. Treat the heart failure as well with digitalis. Support treatment of symptoms. If the patient feels any dyspnea, any angina or whatsoever, we need to treat this with various drugs as well, and to convert the dysrhythmias. So the normal heart appears like this, but for restrictive cardiomyopathy, the walls of the ventricles become stiff, but they are not necessarily thickened. So it's somehow caused by the fibrosis, or there's a scar formation that has happened in the inner lining of the heart. And if that happens, it won't effectively pump blood out of the heart, since there's rigidity, there's thickening and rigidity of the ventricular walls, as you can see here. Next, we have the arrhythmogenic right ventricular cardiomyopathy, ARCVC. The heart muscle here is progressively replaced by fibrous and fatty tissue, which commonly affects the right ventricle only. So fibrous and fatty tissue is seen in this sample of a heart specimen. So you can see the heart or the fatty tissue there. Treatment of this is by giving antiarrhythmic agents, ACE inhibitors to control hypertension, diuretics, and anticoagulants to prevent clot formation. So pathophysiology of this is infiltration and replacement by fibrous scar and adipose tissue. This is initially localized, but once it worsens, it progresses, it spreads and affects the entire heart. And once that happens, there will be right ventricular dilation. And if there's dilation of the right ventricle, there will be poor contractility, leading now to the arrhythmia and or heart failure. So again, heart failure or arrhythmia is the end result here. Next, we have the Takotsubo cardiomyopathy, or it's also known as the stress cardiomyopathy or the broken heart syndrome. This is such an interesting case because the cause of this condition, Takotsubo cardiomyopathy, is by extreme emotions and stress. So there's sudden weakening of the midsection of the apex of the heart, brought about by extreme emotions and stress. It's the treatment of this is same with acute heart failure. So as you can see here, the heart becomes like this, the octopus trap in Japanese, the Takotsubo. That's why it's termed as the Takotsubo cardiomyopathy. And what happens, the midsection and the apex of the heart is weakened, as you can see here in the illustration. That will make this heart pump ineffectively because it seems like the ventricles of the heart is trapping the blood that it is containing, like that of the Takotsubo octopus trap. So, what are the probable causes of this? A news of unexpected death of a loved one, a frightening medical diagnosis, such as cancer or AIDS, for example, domestic abuse, losing a lot of money, so if a person went bankrupt, natural disasters such as storms, earthquakes, volcanic eruptions, a surprise party. So if someone was surprised somehow, this can happen. Having to perform publicly. So an extreme case of stage fright has happened. Job loss, so if someone was fired. Divorce. Physical stressors such as asthma attack or a car accident or major surgery. So any of these things can cause this kind of cardiomyopathy. So nursing interventions, we advise the patient to avoid alcohol, cessation of smoking as well, and restriction of sodium in the diet. And monitor for signs and symptoms of progressive heart failure and compromised renal perfusion, since the kidneys can be affected once the patient has heart failure. There will be decreased renal perfusion as well. And if the patient will be given various drugs for heart failure, such as digitalis, we need to know our nursing responsibilities. We need to know when it is toxic. And warn the patient against any strenuous activity that they are going to do or any physical activity. We always need to monitor the patient's condition, such as the vital signs and the intake and output. And health teachings for the patient and family. Ways how to increase activity tolerance. So, patient should gradually increase their activities of daily living. They should not abruptly do strenuous activities. It should be gradually increased by the patient. So in heart failure, there's a common NCLEX question that they have been asking. If the patient, for example, asks you, so let's say the patient is married and has a spouse, when is the patient or when is it safe to have sexual intercourse again? Among the choices there, the correct answer is if you see the choice that the patient is able to go up the stairs without tiring easily. So they can easily go up the stairs without putting so much effort. That is the time that they are or they can engage in sexual intercourse for patients who are suffering from heart failure. So always take note of that. If the patient is able to climb up the stairs without any effort, that's the time they can have intimate sexual intercourse with their spouse. Also, reduce anxiety. Remove all the stressors from the patient's environment. So that's one way of reducing anxiety, or any yoga practice can also help with this. Meditation practices. Perform emergency CPR if the patient's or if the heart arrest has occurred. And the operation of the defibrillator. We can be trained to do that as well. So if you are into intensive care, you can be taught how to do this. Exercise guidelines as well, because they cannot do strenuous exercises yet. Again, gradually increase the amount of exercise for these type of patients. And encourage patients' family members to undergo diagnostic exams for cardiomyopathy as well, because this can occur also within the immediate family. It can be hereditary, especially if it is idiopathic. So that's it, guys, for our lecture regarding cardiomyopathy. I hope you have understood all the things that we have discussed for today. Again, if you have any questions about our lecture, please do not hesitate to send me a message. So thank you again, and have a great day, everyone.